Ovarian cancer is known as a silent enemy, but it can be fought with knowledge and prevention. According to the World Health Organization, this type of cancer is the 8th most common among women and ranks 7th among those that cause the most deaths. It's an alarming statistic, but it highlights the importance of recognizing warning signs. When diagnosed early, the chances of recovery increase significantly. In this video, you will learn about symptoms that should not be ignored and the key risk factors, helping protect your health and that of the women around you. The greatest challenge of ovarian cancer lies in its ability to progress without causing clear symptoms in its early stages. This makes early diagnosis more difficult and increases the associated risks. Many women only discover the problem when the cancer has already reached an advanced stage. However, staying well informed can make all the difference. By recognizing subtle signs and understanding the factors that increase risk, you will be one step ahead. In this video, our goal is to empower you with the knowledge needed to identify early symptoms and act quickly, helping to save lives. The ovaries play an essential role in the female body, being responsible for the production of eggs and hormones such as estrogen and progesterone. However, it is in these small organs that ovarian cancer can silently develop. This type of cancer can arise in different parts of the ovary and is divided into subtypes, such as serous carcinoma and germ cell tumors. The biggest danger is that, in its early stages, it usually does not present noticeable symptoms, allowing the disease to progress undetected. Over time, the tumor may grow and begin to press against other organs, resulting in symptoms that are often mistaken for common problems, such as bloating or abdominal discomfort. This lack of specific symptoms makes ovarian cancer so dangerous and reinforces the importance of paying attention to the risk factors and symptoms we will discuss next. Knowing the risk factors for ovarian cancer is crucial for prevention and early diagnosis. Some of these factors are unavoidable, such as age. Most cases occur in women over 50, especially after menopause. Another important factor is a family history of cancer, such as ovarian, breast, or colorectal cancer, which significantly increases the risk, particularly in women with BRCA1 and BRCA2 gene mutations. Women who have never been pregnant or who had early menarche, first menstruation before age 12, and late menopause, after age 50, are also at higher risk. Prolonged use of hormone replacement therapy, HRT, can increase the chances of developing ovarian cancer, as can obesity. Other conditions, such as endometriosis, are also associated with ovarian cancer. Understanding these factors helps in early detection and, in many cases, can be the key to saving lives. Now, let's discuss the symptoms that may indicate ovarian cancer. Although cancer is often silent at first, some symptoms begin to appear as the disease progresses. Paying attention to them is essential for early diagnosis. Persistent abdominal bloating. Many women mistake this for simple weight gain or gas, but bloating that does not go away over time may be an important sign. Frequent abdominal or pelvic pain. Constant or intermittent pain, especially when accompanied by bloating, is another symptom to watch for. If it lasts more than a few weeks, it's essential to consult a doctor. Loss of appetite or early satiety. Feeling full quickly, even with small portions, may indicate that something is wrong. This symptom can be confused with digestive issues, but if it persists, it should be investigated. Changes in bowel habits. Constipation or diarrhea without an apparent cause can be a sign of ovarian cancer. The tumor may press against the intestines, affecting their function. Frequent need to urinate. Feeling a constant urge to urinate or having difficulty fully emptying the bladder may be due to the tumor pressing on the bladder. Persistent fatigue. Extreme tiredness, even after rest, is a symptom often reported by women with ovarian cancer. Back pain. Back pain that does not improve with conventional treatment may be a sign of the disease, especially when associated with other symptoms. Abnormal vaginal bleeding. Bleeding outside of the menstrual period or after menopause should not be ignored. Indigestion, nausea, or vomiting. When these symptoms become frequent and unexplained, they may be related to ovarian cancer, and medical investigation is essential. These symptoms can be confused with less serious conditions, but if they persist, it's crucial to see a gynecologist for a detailed evaluation. Detecting ovarian cancer in its early stages is crucial for improving the chances of recovery. Although ovarian cancer often does not cause noticeable symptoms early on, regular health monitoring and exams can make all the difference. Early diagnosis can change the disease's trajectory, providing more treatment options and a better prognosis. Tests such as transvaginal ultrasound and the CA-125 blood test are essential for the early detection of ovarian cancer. The ultrasound helps visualize abnormalities in the ovaries, while the blood test checks for tumor markers, which may be elevated in the case of cancer. Although these tests are not foolproof, they are essential for women who show symptoms or belong to high-risk groups. Additionally, early diagnosis allows treatment to begin at more manageable stages of the disease, which may include surgery, chemotherapy, or other targeted therapies. Identifying the problem quickly increases the chances of treatment success considerably. Regular checkups and seeking medical attention when unusual signs appear are actions that can save lives. While ovarian cancer is difficult to completely prevent due to factors like genetics and age, some measures can reduce risks and improve overall health. Prevention is mainly about maintaining a healthy lifestyle and being aware of risk factors. Women with a family history of cancer, especially breast or ovarian cancer, should discuss with their doctors possible options for more rigorous surveillance, such as more frequent exams. Diet also plays a key role. Balanced diets rich in fiber and low in animal fat can help reduce the risk of ovarian cancer. Additionally, maintaining a healthy weight and engaging in regular physical activity are habits that promote prevention, as obesity is one of the identified risk factors for ovarian cancer. For women who have already been diagnosed with ovarian cancer, ongoing medical follow-up is vital. After treatment, many professionals recommend regular exams to monitor any possible recurrence of the disease. Emotional and psychological care is also essential, as the impact of diagnosis and treatment can be significant. Support therapies, such as support groups and counseling, can help manage stress and anxiety. Awareness is one of the most powerful weapons in the fight against ovarian cancer. The more women are informed about risk factors, symptoms, and the importance of early diagnosis, the greater the chances of detecting the disease in its early stages and improving the possibilities of recovery. Sharing information can literally save lives. Sharing videos, articles, or conversations about the topic helps break the silence around this disease and encourages more women to seek preventive exams and medical guidance. This knowledge also strengthens community support, encouraging those undergoing treatment to feel welcomed and understood. Awareness transforms fear into action and promotes positive changes at both the individual and collective levels. By talking about ovarian cancer, we create a cycle of prevention, support, and information that benefits generations of women. It's important to remember that although ovarian cancer is dangerous, it doesn't have to be a sentence. With early diagnosis, effective treatments, and adequate support, many women overcome the disease and live long and healthy lives. So, take care of yourself and encourage the women around you to do the same. Together, we can create a network of support and information that saves lives. If this content was helpful to you, share it with friends, family, and colleagues. Prevention begins with each of us. Health is our most precious asset. Value it every day.